Hi, I'm Virginia from Write Clinic, and this is the Medical Writing Uncut podcast. Here with me today is Shou Jin, who is in Malaysia. Thank you so much for being here today.
Thank you very much, Virginia, for the invitation. It's nice to have, it's nice to be in here with you.
Perfect. Thank you so much. So, tell me about yourself. How did you get into medical writing?
Okay, so my name is Shou Jin. You can call me Jin in short. So I when for me when I started as a medical writer, it has to backtrack till when I was doing my PhD. I was doing the final year of my PhD, and then there was this opportunity to join a company as a medical writer intern. So I actually took that offer and joined a local medical communication agency as a medical writer intern. A few months later, they offered me a permanent position as a medical writer, and I took that up because I really like medical writing, and it is the first time that I was exposed to the career as a medical writer. I know what a medical writer does, and I feel that it is so interesting. So that's why I took it up as a permanent position. And fast forward 18 months later, I feel that after I've submitted my thesis, I feel that I want to transition into a larger organization. That's why I moved to my current organization as a medical writer, which I deal with a lot of internal stakeholders rather than different pharmaceutical companies. Yeah. So that's my journey.
Amazing. Thank you. So, how long ago was that? How long have you been a medical writer?
So I've been a medical writer for the past, I would say, close to 2 years. So I started off last year around April, and then I just joined my current organization about 2 to 3 months ago. Yeah.
Amazing. And so, how was being an intern different from working full time?
Well, to be honest, the job scope isn't that much of a difference when compared to being an intern and a medical writer. Obviously, during an intern, that there's a lot of learning processes because back then when I joined as a medical writer intern, I didn't know what is an emailer, I didn't know what is an e-detailer, so I definitely need time to pick that up and how we organize content in a promotional manner as compared to manuscript writing, which all PhD are quite good at. But for promotional kind of writing for healthcare professionals or even patients, the type of writing and organizing the content is slightly different, and we need to learn the tips and tricks that we can actually organize the content so that it's good at first glance. The key message can be delivered concisely and effectively. So when I transitioned into a full-time medical writer, then I started off to handle projects independently. I jump into client calls, take in all the requests, and I can manage the project end to end. Later that I was also responsible to mentor other medical writer interns to teach them on, how to deal with all the medical writers from A to Z. Yeah, something like that.
Amazing. So, what would you say is one of the skills that you've learned as a medical writer that you didn't have as a PhD?
That's a great question. I think one of the biggest skill is that less is more. So in promotional kind of content writing, we don't have all the space in the world. We need to capture the attention of the healthcare professionals or the patients in the shortest time possible, and therefore we have to craft the sentence in a very, very simple way, but it has to be impactful and concise. So that's one of the skill set I think that um, most of the PhD graduates lack of, because when we write review paper, we just go on and on. When we write thesis or so, it's like hundreds of pages of documents. But in medical writing, we don't have that kind of liberty. We have to sort of concise our content into one sentence, and by reading that one sentence, the readers should grasp the overall idea. They should know what the document is all about. And then if they're interested, then they can read on more details, which we will provide them after the main title. Yeah, so that's one of the main skill that I'm still learning, to be honest. So it's going to be better and better through practicing, I would say. Yeah.
Great. So, do you work remotely or do you go into the office every day?
So there's an option to work virtually. So, it's like 2 days office day per week, but I like to go to the office because the office environment is very comfortable, and I'm not so productive by working from home. But I do know a lot of medical writers, a lot of my friends, they love working virtually because that's just um, their way of working, and it's away from all the disturbances. There's not much of talking with other people so that they can have their own focus and me time. But for me, I like to go to the office and I just wear in my noise cancelling earphones and I can do my work. Yeah.
Brilliant. So, what would be your top tips for someone who wants to get into medical writing?
Great. So, for someone who wants to get into medical writing, my biggest advice is to try it now. So, you have to try it first, and you can and you then you will know whether you like it or not. So, you really have to try it. You can just do some simple writing, whether it is LinkedIn posts or other platform, but just start to write something that interests you. It can be cancer, it can be metabolic disease, and anything that interests you. You can just start writing and get feedback from others. So people will comment and you can just DM them and ask for feedback. Well, what's your writing feels like with them. So after getting all those feedback and you can improve your writing slowly and slowly, then you will become a better medical writer. And if you really want to know what the industry is about, you can also DM some medical writers within the industry, and I'm sure they'll be happy to share what does a medical writer does, what kind of writing do we deal with, so you can know better about what the medical writer does, and hopefully it can get you into a medical writer career. Yeah.
Brilliant. So, what are you looking forward to in your career now that you've got into the job and you're there full time? Do you want to climb the ranks to become a more senior medical writer or a director? What kind of things? Or are you just comfortable where you are for now? So,
I mean, I'm still relatively new in my organization, so my top aspiration is now to learn about the organization, to fit into the team and collaborate with all the other team members so that I can contribute to the team and the organization marketing goals or all those kind of requests. So that's the main part. Of course, like if there's opportunity to climb in the more senior position to mentor other medical writers, then I would be happy. But for now, it's just stay in that position and get comfortable with the organization and learn everything that I can about the organization and all the different products and knowledge that the company carries. Yeah.
great. So, you said you finished your PhD and then you got into medical writing. So, what were your other options after you completed your PhD and why did you choose medical writing?
Oh, so technically, I haven't completed my PhD yet. I submitted my thesis, but I haven't officially graduated yet. So, during the final year of my PhD, the opportunity came up as a medical writing intern. Before that, medical writing was not an option at all, It- because I don't even know what does a medical writer do. So it's not part of the career option. So the original plan was to probably get a postdoc or jump into the academic fields, become a lecturer, all those kind of conventional stuff, which is to continue doing research. But then after that opportunity of becoming a medical writer intern, then I know that I like writing even more than the research itself. Even though when I was doing my PhD, then the thing that I enjoy most is to write review articles, crafting all the figures that describe what is my review articles mentioning, and I enjoy the writing part a lot. So that's why I made up my mind that probably medical writing is a thing for me, but not research. I love research, but not most of the time. Not when I feel my experience and experiment and all. So another thing that I don't really like research is because of the work-life balance. So I'm doing something on skin research, and whenever there's a skin sample, I need to rush to the hospital and process the skin sample. So the work-life balance is not a good thing to do research. Another thing is that it's quite far away from the patients. What we are doing is preclinical research. It takes a long time to reach the final stage, which is to deliver it to the patients. And I don't really like to be part of that. But as a medical writer, I've attended symposium, I've attended at board meetings where the healthcare professionals are discussing something that is really impacting the patients here and now. So I'm very fortunate and happy to be part of that conversation and documenting all of that as a medical writer. And I hope that, I can do more of this in the future to contribute towards the healthcare's advancement. Yeah.
Brilliant. That was really, really interesting. Thank you so much for sharing all of that. Do you have any final words or anything that you wanted to mention?
Not much really, but I do create content on LinkedIn, and hopefully I can create more video content like this or something about medical writing. So if anyone of your audience are interested, you can follow me on my LinkedIn. Yeah.
Perfect. Yeah, I'll definitely leave your links in the. Oops, sorry. I'll I'll definitely leave your LinkedIn in the description box below. Oh wait, actually, I wanted to ask you about AI. So,
Okay.
do you use AI in your work?
Okay. So definitely AI is a good tool, and definitely we do use AI in our work. I believe that AI is not there to replace medical writers, but eventually it will replace all those medical writers that do not know how to use AI. So I think AI is good in summarizing all the different contents, all the complex documents. So it is helping medical writers to do all the laborious work that we don't really like to do. We like to create content, we like to craft a sentence in a creative way, and we can spend more of our time to do all the productive um, thing. Yeah, but we have to use AI ethically and all. We shouldn't, just do copy and paste. It has to go through human for now. But I'm not sure if AI is going to replace medical writers in the future. But for me, I don't think it will. Yeah.
Brilliant. And so, do you build the AI within your company, or do they have a team that does that for you?
Yeah, I mean that, yeah, it's confidential, so I couldn't really share a lot of the company's AI thingy, but I believe like a lot of the organization, they have AI thing within, and they are doing something by using AI in the organization. Yeah, so that's the one that I can tell. Yeah.
Yeah, yeah. I think a lot of organizations are now building their own AI. And obviously, I didn't want you to go into any details because it's confidential. So,
Yeah.
everything's very competitive, especially when it comes to technology. But thank you for sharing that. I think, yeah, everyone is trying to build up their technology so they can be more efficient. But like you said, I think humans will always need to be involved. So, thank you for that insight.
Yep. You're welcome.
All right, cool. So, I'll leave Jin's LinkedIn in the description box below. And thank you so much for watching or listening. Make sure you follow Jin and read about his journey as a medical writer, especially early in his career. So thank you so much.
Thank you very much, Virginia, as well, for the opportunity.
Yeah, you're welcome. Absolutely. Come again soon.
Sure.
One last question. Do you write in English or any other languages? What's the common language that you use to do your medical writing in?
Okay, so in Malaysia, it is very common that we write in English, although that we have a very diverse population. We have like Malay, Chinese, and English, but most of our healthcare communication are in English. So most of the healthcare professionals, they communicate in English, but there are some exceptions. For example, for patients material, for poster that is meant for patients, there might be sometimes that we need to translate the materials into three different languages, which is Malay, Chinese, and English, sometimes even Tamil. So for the Indian population, so the translation materials are mostly there for only patient material, but for healthcare professional material, mostly it is in English. Yeah.
Brilliant. That's really interesting because I recently did a project where I had to copy and paste a lot of captions into different languages, so 10 different
Uh,
languages. So
yeah,
that's really
translating is
interesting.
always tricky. Yeah.
Yeah, yeah. And also because sometimes especially if you have special characters and they take up much more space than the original text.
Yeah.
So you have to be mindful when you're translating that you might not have as much space on the poster as you thought, or you have to make the font smaller or something like that. So
Yep.
yeah, thank you so much for sharing that. All right, we'll
Okay,
catch
no
you later.
problem.
Bye.